the Maryland Department of Health and Mental Hygiene, Hospital Breastfeeding Policy, Maternity Staff Training Program. Global Strategy, Session 1. This training program was developed in collaboration between the University of Maryland Upper Chesapeake Medical Center and the Maryland Department of Health and Mental Hygiene. This program's aim is to train Maryland hospitals' maternity staff to meet the objectives of improved lactation support in Maryland. The training consists of 15 audio-recorded sessions, each approximately 1 hour in length. The training will help hospitals meet the goals of the Maryland hospital breastfeeding policies and, if desired, the training requirements for hospitals seeking the World Health Organization's baby-friendly hospital certification. Headsets or speakers will be required to complete this training program. Objectives. 1. Identify global strategies for improving infant feedings. 2. State the aim of the Maryland Hospital Breastfeeding Policy and the Baby-Friendly Hospital Initiative recommendations. 3. Give 3 examples of how hospitals and healthcare workers can promote, protect, and support breastfeeding. 4. State how staff can assist their healthcare facility to improve its practices to meet the policy's goals. Poor infant feeding practices impact families, communities, and health services. There are many long-term outcomes that negatively affect our population. Increased rates of breastfeeding can have positive impacts on each individual, each family, each community, each state, and the nation as a whole. If 90% of women in the United States breastfeed exclusively for 6 months, it is estimated that the United States would save $13 billion per year in infant health costs alone and prevent 911 deaths. Further research has shown that it can save an additional $860 million from prevention of up to 5,000 cases of breast cancer, about 54,000 cases of hypertension, and nearly 14,000 heart attacks annually. Several internationally and nationally recognized programs are important to the guiding and development of hospital breastfeeding policies and are relevant to their implementation. Strategies within the Maryland Hospital Breastfeeding Policy are supported by national policies, laws, and programs to promote, protect, and support breastfeeding and protect the rights of working women. Some of these national programs are Healthy People 2020, a national movement by health officials to improve the health and well-being of Americans using science-based objectives. Current annual evaluation of this, the Breastfeeding Report Card, measures the number of infants born in facilities that support lactation. The WHO UNICEF Baby-Friendly Hospital Initiative, a global program sponsored by the World Health Organization and the United Nations Children's Fund to encourage and recognize hospitals that offer an optimal level of care for lactation by following the 10 steps to baby-friendly. The International Code of Marketing of Breast Milk Substitutes was developed by the World Health Organization and UNICEF to emphasize the importance of maintaining the practice of breastfeeding, reviving the practice of breastfeeding where it has declined, and to improve the health and nutrition of infants and young children. The 27th World Health Assembly in 1974 noted the general decline in breastfeeding related to different factors, including the production of manufactured breast milk substitutes, otherwise known as infant formula, and urged member countries to review sales promotion activities on baby foods and to introduce appropriate remedial measures, including advertisement codes and legislation where necessary. The 33rd World Health Assembly in May of 1980 endorsed in their entirety the statement and recommendations. Quote, "There should be an international code of marketing of infant formula and other products used as breast milk substitutes." End quote. The code outlines for government, healthcare facilities, healthcare workers, formula salespeople, and companies how breastfeeding should be promoted and protected, and lists the acceptable ways to use a breast milk substitute with the goal of not interfering with a mother or child's breastfeeding experience. The Centers for Disease Control, Maternity Practices in Infant Nutrition and Care, otherwise known as MPINC, Quality Practice Measure Benchmark Report, is a survey developed by the CDC and used by facilities that provide maternity care services. It measures each hospital's maternity care practices compared to the national average. The survey provides specific interventions that, when implemented, improve breastfeeding outcomes. It lets facilities know where they did well nationally and suggests where quality improvement is needed. The United States Surgeon General's call to action to support breastfeeding are recommendations from the Surgeon General's office on the importance of supporting and promoting breastfeeding. Within the area that focuses on hospitals and healthcare facilities, it recommends implementing the Baby-Friendly Hospital Initiative 10 steps. The American Academy of Pediatrics policy statement on breastfeeding and the use of human milk are recommendations from the American Academy of Pediatrics on the benefits of breastfeeding for infants and children and recommends following the 10 steps. The Joint Commission's Perinatal Core Measures on Exclusive Breast Milk Feeding is a nonprofit organization responsible for the accreditation process for hospitals and most healthcare facilities. As of January 2014, all hospitals are required to measure exclusive breastfeeding rates as part of their Joint Commission certification. Healthy People 2020 is a national initiative that outlines 33 maternal, infant, child health objectives for improved health goals for the United States. In 2007, only 2.9% of all babies were born in facilities that provide recommended care for lactating mothers and infants. The Maternal Infant Child Health Objective number 24 within the Healthy People 2020 document focuses on improving hospital support for breastfeeding. The goal is to increase this to 8.1% by 2020. Currently, fewer than 200 hospitals in the United States follow recommended care for lactating couplets. Hospitals following a policy in agreement with the Maryland Hospital Breastfeeding Policy or World Health Organization Baby-Friendly Hospital Initiative recommendations will provide care that meets this Healthy People 2020 goal. The Baby-Friendly Hospital Initiative is a global initiative of the World Health Organization and UNICEF that aims to give every baby the best start in life by creating a healthcare environment that supports breastfeeding as the norm. It encourages and recognizes hospitals and birth centers that offer an optimal level of care for breastfeeding. The core components of the Baby-Friendly Hospital Initiative are the UNICEF 10 Steps to Successful Breastfeeding, which are designed to facilitate the role of the facility in providing women the choice and opportunity to breastfeed, regardless of the method of birth. The initiative was launched in 1991, and by the end of 2013, more than 21,000 health facilities worldwide had been officially designated baby-friendly. At the same time, less than 200 hospitals have been accredited in the United States. According to data from the 2014 Breastfeeding Report Card, this accounts for just under 8% of births occurring in a baby-friendly hospital in the U.S. in 2011. As seen by this 2011 year data collected by the United States Centers for Disease Control, Maryland is close to national averages in most areas, yet still falls behind the Healthy People 2020 goals in all categories. Implementation of breastfeeding policies should help to improve breastfeeding rates among those who deliver in Maryland. The Maryland Hospital Breastfeeding Policy provides a framework for enabling mothers and babies to acquire the skills they need to breastfeed exclusively. The American Academy of Pediatrics recommends to continue breastfeeding for at least 1 year and exclusively for at least 6 months. The World Health Organization recommends continuing breastfeeding for at least 2 years and also exclusively for 6 months. Both recommendations agree that breastfeeding can and should continue longer if mutually desired by both mom and infant. The Maryland Hospital Breastfeeding Policy is a document produced by the Maryland Department of Health and Mental Hygiene to guide Maryland hospitals providing maternity care services in the best practices for supporting breastfeeding in the hospital. It does not require hospitals to obtain baby-friendly certification. However, the Maryland hospital breastfeeding policies are based on the World Health Organization and UNICEF Baby-Friendly Hospital Initiative, begun in 1991, which has grown to improve breastfeeding support and outcomes in hospitals all over the world. Only 34 states currently have at least one baby-friendly hospital. Shady Grove Adventist Hospital was the first hospital in Maryland to obtain this certification in 2014. The hopes are that with the development of the Maryland Hospital Breastfeeding Policy and the Maryland Maternity Staff Training Program, more hospitals in Maryland will be better equipped to provide evidence-based care for all breastfeeding mothers. Hospitals are encouraged to personalize their breastfeeding policy to meet the needs of their individual facility. In doing so, staff should keep in mind that policies implemented should follow the Maryland Breastfeeding Hospital Policy Framework. Hospitals applying to the Baby-Friendly Hospital Initiative will implement policies that exceed the Maryland recommendations in order to meet the standards for the Baby-Friendly Hospital Initiative. During this training program, we will discuss what the Maryland Hospital Breastfeeding Policy means, how to implement a breastfeeding policy, and the importance of staff members in making a health facility supportive of breastfeeding. We'll also cover practices related to the marketing of breast milk substitutes and how to support, promote, and protect breastfeeding. Finally, we'll talk about the policy assessment process. The 10 Maryland Hospital Breastfeeding Policy recommendations are based on the Baby-Friendly Hospital Initiative 10 steps. The Maryland policy steps differ in that first, Maryland's policy recommendations are meant to encompass breastfeeding only. Policies related to the use of breast milk substitutes are assumed to be found under an infant formula or breast milk substitute feeding policy. Second, some of Maryland's steps are in a different order than that of the Baby-Friendly Hospital Initiative. This does not diminish the importance of each step. In addition, the content of the steps focuses upon the same issues as that of the Baby-Friendly Hospital Initiative 10 steps. Let's look at each step now. 1. Have a written policy that is routinely communicated to all healthcare staff. A policy is not a treatment protocol or standard of care. Policy means that all staff are expected to follow the same protocols and standards, and that staff are required to do so by those in authority. It is not a personal decision to follow policy or not to follow it. This is similar to other policies. An individual does not decide whether to give a vaccine or what information to record on a birth certificate. If a policy is not followed on a specific occasion, the reason for not following it should be recorded. The written policy should include all of the 10 recommendations in order to be comprehensive and to meet the requirements of both Maryland's Hospital Breastfeeding Policy recommendations and the Baby-Friendly Hospital Initiative. Hospitals going baby-friendly must also address the International Code of Marketing of Breast Milk Substitutes. Language consistent with this policy should also extend to all areas of the hospital that care for childbearing women and babies. 2. Train all healthcare staff in skills necessary to implement the policy. The second step is about training. Training allows all present to understand the reasoning behind each step and allows understanding in how to implement each step of the policy. This training program aims to help you feel confident in your knowledge and skills to care for mothers and infants in everyday practice. For those going baby-friendly, this training will be approximately 15 hours of classroom training, and you'll also have 5 hours of supervised clinical experience. Number 3, inform all pregnant women about the benefits and management of breastfeeding. The third step focuses on educating pregnant women about breastfeeding. While focusing on this step, you will learn communication skills that will enhance how you talk with pregnant women, mothers, and coworkers about the importance of breastfeeding. You will also learn to educate on practices that support the initiation of breastfeeding. The goal here is to provide education for pregnant women so they can make an informed decision about how they will feed their newborns. And when they breastfeed, This information will also help them initiate practices that are likely to lead to successful breastfeeding experiences. Number 4, help breastfeeding mothers initiate breastfeeding within 1 hour of birth. The 4th step concentrates on what can be done immediately after birth to enhance the success of breastfeeding. During this part of the training, you will learn about how placing the baby skin to skin immediately after birth and early initiation of breastfeeding set the new breastfeeding dyad on the path of breastfeeding success. 5. Show breastfeeding mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. During this step, we will review the skills that new mothers and babies begin to learn in those very early days. You will be taught how to assist a mother in positioning her baby at the breast and how to teach her to attach her baby, proper latch-on. We will also cover hand expression of breast milk, as this is a skill every mother should know, even if she does not expect to use it. Finally, during this step, we'll focus on how to help a mother to maintain breastfeeding when separated from her baby. 6. Give breastfed infants no food or drink other than breast milk unless medically indicated. The goal here is to focus on breastfeeding. Have mother and baby practice the new skill they are learning and allow the process to establish the milk supply necessary. Feedings other than breast milk at this time interfere with the ability to do this. Hospitals following the Step 6 for Baby Friendly will also require their staff to learn to explore with mothers the reasons why some may choose not to breastfeed and discuss the risk of not breastfeeding. They will learn to provide education to the breastfeeding mothers who request breast milk substitutes. They will also learn to teach mothers who choose to formula feed how to properly prepare formula. The Maryland policy only covers breastfeeding and does not discuss the use of breast milk substitutes. 7. Practice rooming in. Encourage breastfeeding mothers and infants to remain together 24 hours a day. During this part of the training, you will learn how breastfeeding is enhanced when we minimize separation of mothers and infants for routine care. We will also cover how routine care can easily be completed if mom and baby are together. In addition, we'll highlight that we need to educate our families as well by teaching parents that both mother and infant will benefit from being kept together. 8. Encourage breastfeeding on demand. Step 8 focuses on how staff should teach parents to understand and respond when a breastfed baby is hungry. We will cover identification of early feeding cues and other normal newborn behaviors relating to feeding. 9. Give no pacifiers or artificial nipples to breastfeeding infants in the hospital unless medically indicated. Pacifiers and artificial nipples can interfere with establishing and maintaining breastfeeding, as infants suck differently on the breast than they do on an artificial nipple. When a mother requests her baby be given a bottle or pacifier, the staff will learn how to explore the reasons for that request with the mother and how to educate her on the possible negative impacts that these can have on her breastfeeding success. However, pacifiers may be necessary at certain times. This step requires that medical need for use of pacifiers be determined. For example, pacifiers may be used during painful procedures, such as circumcision, but should be discarded immediately after the procedure. 10. Foster the establishment of breastfeeding support groups and refer breastfeeding mothers to them upon discharge from the hospital or clinic. Many hospitals have their own breastfeeding support groups. Some develop them as they implement breastfeeding-friendly hospital policies, while others network with other resources and support groups in the community to support breastfeeding families. Some options for breastfeeding support that can be shared with mothers include La Leche League, their baby's pediatrician, the International Lactation Consultant Association website, WIC, and the Maryland Breastfeeding Coalition website. Hospitals that have used this and similar courses have found that making these changes within their facilities has 1. Improved care through provision of better consistency, prevented or identified high-risk situations early, and integrated a high level of care at a potentially vulnerable time. 2. improved promotion of best practices for establishing successful lactation, prevented potential readmissions, and promoted the health of mothers and infants through breastfeeding. 3. Provided a positive image through families recognizing a valuable service given to them, focusing on the patients, and ultimately finding that patients were recruited and retained as a result of these hospital practices. 4. Increase in the initiation and duration of breastfeeding. Furthermore, studies have shown that hospitals that follow at least 5 of these steps also show improved outcomes with breastfeeding. Therefore, those in the process of implementing this change are likely to see beneficial outcomes prior to having all of the 10 steps implemented. With the maternity staff training program and better understanding of the Maryland hospital breastfeeding policy, along with the baby-friendly 10 steps, you and your hospital will be better able to promote, protect, and support breastfeeding for the families in your communities. Each training program session that follows will provide further detail and information for you to best support mothers and infants in the hospital setting.